Welcome to another edition of the DAMY Vlog. My name is Dr. David Duizer. I'm a naturopathic doctor and the medical director at DAMYhealth.com. On this show, we talk about all things holistic health and well-being, and today we're talking about genetic health. Because I practice a holistic approach to chronic disease management, I'm looking all around for ways to properly optimize a person's health, to properly support them to heal from whatever diagnosis they've been given. The new wave of optimal well-being is genetic health. It has become a wave for a reason. It's important. It really is the future of medicine, and it is really in the now when it comes to clinical practice. We have lots of data about specific gene expressions that are very important for people to know about. So we've made it a prominent part of our practice here. And we've seen benefit in knowing about it, using it clinically, applying specific treatments that are considered epigenetic, or treatments that are supportive of a person based on their individual gene expression. So today I'll talk a little bit about that practice and how we do it and why it's great. So genome therapy or genetic therapy or using epigenetics or epigenetic mechanisms is relatively new, and it's, of course, because of that, it's new to our practice as well. But we're about 6 months in now, and we've seen lots of benefits clinically in using information about a person's genome to help support them, whether it be nutritionally or lifestyle-wise or supplement-wise. And it has given us insight that we may not have had prior. In many cases, we wouldn't have had prior. So I'm grateful for this type of therapy and proud to be able to include it in clinical practice. Let's jump into actually what I'm speaking about. I'm speaking about using genetic code to assess a person's functional health, their ability to be in the world in a healthy state. So because I mostly do chronic disease management, most people who see me are looking to overcome an illness or feel good despite their illness, I have had to look beyond the conventional specific therapy for illness type approach, and I really do use a holistic approach in my clinical practice, and genetic therapy is really part of that holistic approach. So what am I speaking about when I say genetic therapy? Basically, we're talking about SNPs, single nucleotide polymorphisms, or the way a gene is expressed based on having one or more nucleotides that are different than the norm. So basically, when you have a gene, the gene would code for a specific protein to be produced. And sometimes the way the gene is expressed, there's single nucleotide shifts or single nucleotide polymorphisms. So basically, if you have an AT or a CG, these are how a genome is made. There could be one little area of a genome that is different for you specifically, and you could still make a protein that works, but it might not work as well as it would if it was in its optimal state. So basically, the genome is making proteins, and because there is a specific shift in your genome, because there is a single nucleotide polymorphism shift, the protein that is made, or the enzyme that's made, or however this gene is expressed, whatever molecule that is expressed by this gene, is a little different and not as high functioning as it may be if there was the standard presentation of that gene. So we have lots of data for specific SNPs and their impact on our day-to-day health. So some of the most common ones that people are familiar with are MTHFR and COMT, the ability to donate methyl groups. And we know that some people have just low energy in general. This is how we normally find out. They have low energy in general and nothing ever works. And then they've gone deep into functional assessments and they found out that their MTHFR expression means for them specifically that they don't donate methyl groups very well. And then they have applied specific types of B12 and B9, and their energy has gone up. That's MTHFR and COMT treatments in general. But now we know there are specific SNPs indicated in the inability to, for example, convert vitamin D, the inability to utilize zinc and vitamin A, and lots of other nutrients. There are some SNPs implicated in the detoxification of toxins, in the breakdown of hormones, in the regulation of blood sugar, in the ability to absorb and utilize saturated fat, in the there's certain SNPs associated with longevity. There are certain SNPs associated with the increased risk of Alzheimer's disease, the increased risk of type 2 diabetes. So basically, when we know the presentation of these SNPs for a certain person, we have more information about how to help them functionally in their day-to-day life to reduce the risk of disease, or to help them become optimal in their day-to-day function, whether it be for energy or for fat loss or fat metabolism in general, maintaining a healthy weight, preventing obesity, preventing cardiovascular disease is a big one, preventing Alzheimer's disease is another big one. So how do we find out these presentations? Well, the way we do it is usually people go to either 23andMe or Ancestry.com and they get their genome done, and then they get a file that has all of their presentations in a PDF. That PDF can then be that PDF can then be inserted into a calculator that would express how SNPs are presented. And from that data, we can say whether there are places where we can optimize a certain person's health and overall well-being. The one that we use clinically here is called Pure Genomics. We take the file from either 23andMe or Ancestry, and we input it into Pure Genomics, and we get the expressions of that genome that we can then optimize. We also will use calculators like the one that Dr. Rhonda Patrick uses on her website, and we'll use certain presentations from that calculator to optimize well-being. The ones that have the most data, we put most of our focus into. So some are more speculative, so they may not be as useful, but some are pretty clear cut. Like when this is a certain presentation of this one gene, we really need to do something. We focus most of our energy on those SNPs like MTHFR and COMT, for example. We have other ones I should mention about the breakdown of neurotransmitters. For example, dopamine, serotonin, adrenaline and noradrenaline, or epinephrine and norepinephrine. And we put a lot of onus on those as well. So lots of different ways of optimizing health based on these genetic reports, and you get so much more out of the 23andMe and the Ancestry reports when you use these clinically. So I love doing them. People find great benefit in them, and we do have actionable results pretty much every time we do them. Whether it be increasing zinc and copper for a person, or supporting their B12 and B9 nutritionally or through supplementation, we get a lot of information about for supporting a person when we run these calculators. That's just a brand new aspect of holistic management of chronic disease, and we are finding significant benefit in it. So if you have run one of these calculators, or if you go on and you want to find out your ancestry, go on and then you can book a consultation with a naturopath like myself, and we can run these calculators for you and tell you how to optimize your health overall in a visit. So that's my show for today. It's a little bit about SNPs, what they are, how we use them, and I hope you found some benefit in it. If you're looking to optimize your health, run one, and I'll go through it with you. And we'll do everything we can to optimize your well-being. Thanks so much for watching. If you have questions, post them in the comments below. I'm always excited about researching more about genetic well-being and about optimizing health in general, and I'd love to support you along your journey. Thanks for watching, and hope you have a great day.